The most news in the morning. CNN's American Morning. Weekday, 6 a.m. Eastern.
The mantra is, and the rap sort of on this healthcare system as a whole in this country, is that we pay too much and we get too little. I mean, that's what's really driven a lot of what we're talking about over the last year and certainly over the next couple of days. But there are places in the country that do just the opposite. They deliver very high quality care, arguably world-class care, and they do it at a fraction of the cost. I was so curious, how can you possibly do it? Here's what Denis Cortese had to say.
I think it's been an evolution over many years. Over the past several years, payment has really been linked very much to whatever is done. We ended up with a model that is now called fee for service, where we are paid for doing things to people. The ultimate of that, if carried to the extreme, would be the sicker you are, the more money we make as physicians. The more times you come into our office, the more money we make. The more procedures we do, the more money we make. That's just the opposite of what high-value care should be all about. Do we pay the most amount of money to people that may do procedures, or should we be paying a little more money to nurses and primary care doctors to keep you from needing those procedures?
Are there greedy people in the system the way you just outlined it? Doctors greedy. Pharmaceutical companies greedy, insurance companies greedy. Is that what has driven some of this?
I think so. I think that's been part of it. There's an element of greed there. There's always that element of fraud that is lurking in there. And to me, whatever those ancillary drivers are that have pushed prices up have been sort of caused by the fact that the country has not focused on getting its money worth out of healthcare.
And I could tell you, there's really two things that he was really driving at. Was this idea that fee for service, the idea that you pay to take care of sick people instead of just paying to get the person well and get them out of the hospital. And also the Mayo Clinic doctors are salaried, so there's not incentive to order more tests, keep the patients in the hospital longer. And he thinks really those two things, primarily among a few other smaller things, really have what made Mayo Clinic what it is.
It's amazing. And also, what about the type of care that they do? What do they do so differently in terms of the care that keeps the quality up and the cost down?
One of the things they started doing, and it was fascinating from a medical perspective because it made perfect sense after they started doing it, but it was this idea that they're going to do very coordinated care. So, Karen, let's say somebody goes in because they're concerned about maybe having breast cancer. They're going to get the mammogram, they may need to get a biopsy, they may need to have a consult with the surgeon. Typically, that may be 3 or 4 different hospital visits in different parts of the hospital. The scanner may be over here, the surgical consult over here. They put it all sort of in one area. So literally in one visit, the patient can come in, get an answer, get a diagnosis, and perhaps even schedule treatment all within a very short period of time. Makes sense for the patient, obviously, but it's a lot cheaper for the hospital as well. And ultimately, these salaried doctors are all coordinating their care. It's making them much more efficient. And look, this isn't hypothetical. The reason this is relevant is because it worked at Mayo Clinic. And if you can set up these sort of pilot programs around the country, that's how you start to address this very, very sticky issue of cost, which everyone agrees is not being discussed probably enough at this point.